Hello, my name is Rachel Locascio. I'm the nurse manager of operations at the Duke University Hospital Outpatient Urology and Urodynamics Clinic. Today, I'm going to give you a brief overview of my poster on the impact of single-use flexible cystoscopes on outpatient clinical workflow. First, a little bit of background. Reusable cystoscopes are commonly used in outpatient cystoscopies. The majority of individuals use these versus single-use disposable cystoscopes. But there are some limitations to using reusable cystoscopes. First, there's the cost, the initial capital cost of purchasing the scopes and the corresponding monitor towers, along with the cost to repair the cystoscopes over time. They are also labor intensive. Clinical staff time needs to be dedicated to the setup, the cleaning, and the storage of the cystoscopes. Then there's also the increase in infection potential, though that's not what this study was focusing on. The purpose and aim of this study was to evaluate the single-use cystoscopes to see if there was a change to encounter time and clinical capacity. The method we used was a process flow evaluation time study in conjunction with the Duke Performance Services team. We dedicated 2 cystoscopy clinic days to trial our single-use cystoscopes. The first day was the use of our reusable scopes. We did a time study with that day. And then the second was with the single-use cystoscopes, and we compared the data obtained on both cystoscopy days. Both cystoscopy days were exactly the same in that they had 12 patients scheduled each day. 3 clinical staff were assigned to 1 provider, and 3 rooms total were dedicated for the cystoscopy clinic. Our findings were an overall average encounter time decrease. We were able to eliminate 5 total process steps used exclusively with the reusable scopes. This decreased our average encounter time by 22 minutes. We found that with the eliminated steps, which totaled 36% of the total encounter time, that when we used the reusable cystoscopes, that resulted in a 36% increase in staff downtime. You will note in chart 1 that the largest slice of the pie is that downtime. Figure 1 shows all of the process steps utilized for the reusable cystoscope process flow, with the blue boxes notating the reusable cystoscope steps that were able to be eliminated. Table 1 is a breakdown of each of the time study categories and the corresponding amount of time in minutes that was utilized per encounter. Outcomes and lessons learned. So overall, we had a 50% reduction in clinical staff labor per encounter, which totaled 32 minutes. This resulted in the capacity to increase the dedicated cystoscopy clinic from 12 patient encounters per day to 21 patient encounters per day, as we now had a 34% reduction in the average clinical encounter time. Along the way, we did learn a couple lessons. One was that the uploading of images into the EMR was now a little more cumbersome, as we had decided to not purchase the software integration into our EMR system. We have since figured out a workaround, which does not add any additional clinical staff labor time to the process. We also found that we needed to purchase special Y-site adapters for the single-use cystoscopes that we chose to go with. That was to ensure a seamless and efficient use of our graspers when needed. Otherwise, it did add a little bit of extra time and stress onto the clinical staff and provider. There are some implications. Positive feedback from both the provider group and our staff. I was blown away by how staff morale seemed to increase immediately when we got rid of the reusable cystoscopes, and there was really positive feedback from each of the clinical staff members about using the single-use scope, as they were now able to spend more time in direct patient care. We also decreased the overall patient wait time for cystoscopy, which then assisted with decreasing our access issue. We also found that we were able to increase the usable amount of space that we had in the clinic, as we no longer were required to store large monitor towers in our procedure rooms. We also now don't have procedure rooms because cystoscopies can be done in any room, as the monitors for the single-use cystoscopes are so small and mobile. that is an overview of the impact of single-use flexible cystoscopes on the outpatient clinical workflow. Here are my references and acknowledgements. Thank you so much.